So next speaker is none other than Nanja van Geel. Uh, okay, so she will be speaking on influencing factors on patient global assessment score for vitiligo severity. Nanja, over to you.
Hello, it's my pleasure to speak about the influencing factors on the patient's global assessment score for vitiligo severity. These are my disclosures. So, we will talk about the vitiligo severity as perceived by the patients. And this is a difficult question because what defines exactly vitiligo severity? And what is the interpretation of, for instance, a mild, moderate, or a severe vitiligo? For extent, this is probably more easy because this is an objective measure, including the body surface area affected. However, for severity, this is more complicated, as this can also include objective and subjective items. For instance, in addition to the body surface area, affected also the location of the lesions, the photo skin type, or the disease impact. So, and this was exactly the aim of our study that we performed. We were interested to investigate the objective and subjective measures that could influence the severity perception. Moreover, we would like to investigate the interpretation of, for instance, a mild, moderate, and a severe vitiligo. To investigate these questions, we conducted a study. First, we constructed and validated 3 patient global assessment scores, one for extent, one for severity, and one for impact. And in the second step, we investigated the influencing and predicting factors on the PGA for severity. And in addition, we investigated the interpretation of mild, moderate, and severe vitiligo based on stratification techniques, for which we used an anchor question, and in this case, the PGA for extent. So for the PGA, we constructed this in cooperation with the Dutch Society for Vitiligo Patients to ensure the content validity. You can see here the 3 scores that were developed, one for severity, one for extent, and 2 for impact. These scores can also be found in our recently published article. So, subsequently, we validated these PGA scores. The construct validity was confirmed based on hypothesis, and we could also demonstrate a good to excellent intra-rater reliability. And subsequently, we investigated the influencing and predicting factors on the PGA for severity. And this was done based on a survey. We used a questionnaire that included the PGA for severity, extent, and impact, but also objective outcome measures such as extent, skin type, location, and disease activity. We also use subjective outcome measures such as disease impact. In addition, we requested the patients to score each item, each separate factor on a scale from 0 to 10, based on a list that was constructed in advance by the patients. In addition, we also requested to rank the most significant body parts in the context of severity perception. So coming now to the results. The strongest correlation between the PGA for severity were found with disease impact and disease extent. The variation in the patient's severity perception was explained by objective and subjective outcome measures. This was investigated by multiple regression analysis. We could see that severity was influenced by 5 factors, including impact, skin type, extent of the disease, vitiligo on the hands, and vitiligo extent in the face. So based on the scores from 0 to 10 that were attributed to the separate factors, higher scores were seen for location of the lesions, disease extent, reaction from other peoples, disease activity, impact on daily life, and modified behavior. And based on the ranking of the most significant body locations, we could see that the lesions on the face and the hands were ranked on top. So coming now to the interpretation. Because what is, for instance, a body surface area affected of 2, 15 or 40%? Is that mild, moderate or severe? To investigate this question, we used the self-assessment vitiligo extent score. This is a scoring sheet that was based on the physician's version, the vitiligo extent score, and is also validated and published in 2016. We defined the cutoff points of the BSA as assessed by the VIS for each category, and this was based on the PIGA for extent. So we defined the cutoff points between mild and moderate, between moderate and severe and very severe. And we could see, based on our study, that patients considered their vitiligo to be mild in case the body surface area affected was less than 1%. It was moderate if it was between 1 and 6%, and severe if it was more than 6%. So if you project this now on the self-assessment scoring sheet, you can see that the cutoff points are present within the 3 first categories as included in this instrument. We were also interested to compare the results with the physician's point of view. And this was done based on the results we achieved within another study that was performed with physicians with a similar setup. This was based on a workshop that was performed in Rome some years ago. And we could see that the median score per category between the patient and physician's point of view were quite similar. So coming now to the conclusions. So we can say that the severity of vitiligo, that for this situation, a combination of objective and subjective outcome measures seems to be necessary to quantify the severity of vitiligo. But future studies are necessary to confirm these results, in particular in a diverse population, including different ethnic backgrounds. We could also demonstrate that the severity strata for vitiligo extent were mainly present within the first 10% of body surface area affected in vitiligo, and that the median BSA scores per category of extent, so mild, moderate, and severe, corresponded quite well between the patients and the physicians. I thank you for your attention.
Thank you, Nanja. Very nice study. We discuss a lot of issues in the treatment, but we never pay enough attention to what is happening to patient psyche and the mind. And even a single lesion on the exposed sites, as you showed, lead to a lot of distress. And the skin of color has the worst kind of effect.
Yeah.
Thanks.
Yes, this is exactly also the reason why we would like, why we performed this study, to show that if you would like to investigate the severity of vitiligo, you should not only look to one factor, not only the extent, but also, for instance, as we could demonstrate, location can have an impact, or the skin type. So it's more a composite score that should be be available maybe to investigate the severity of vitiligo.
Right. So did you face any difficulty in reproducing subjective assessment of the patients? Is it reproducible?
Yeah, do you mean that we investigate the retest of investigating? Yes, so an intra-rate reliability of the subjective measures? Yes, is that your question?
Yeah,
Yes.
yeah.
Also part of the study. So in the first part, we validated the PGA, the patient's global assessments for extent, impact, and severity, based also on intra-rate reliability assessment. And this was done by an interval of 2 weeks. And we had a nice intra-rate, a good to excellent intra-rate reliability. Exactly.
Thanks, Nanya. Can you
There
address the
is a question
questions in
from
the
our
chat?
good friend
Box?
Iltefat Hamzawi, Somesh. What's the state of outcomes research for the new treatments, and how will this impact this area? This is a general question, but still, I think.
Yes. Yes, I think this is a very important issue we need to take into consideration when we go to the process we have in mind. This will be actually a topic of tomorrow, of my lecture tomorrow. So I think this is very important to take these aspects into consideration if we go through the process to get a consensus on outcome measures. We really need to keep this in mind. And this is also the reason that we I'm talking about consensus project that we are looking for, and this consensus is related to the selection of the outcome measure that you should use in for instance, a trial. And so I think this insight related to severity perception is a very important aspect. We need to take this into consideration. Also for selection of patients for trials, to define the selection criteria, we really need to have more insight in this. This is, I think, an important part.
Patrick has asked one question. What is the state of outcome research for new treatments, and how will this impact? This is
Actually, that is
you
this
answered. You answered. Okay.
repeat question.
Yeah. Another
Iltefat.
question is, what percentage of the patients in your study were skin type 4 to 6?
Yes, this is a good question because in our population, and this is a limitation, I also mentioned it is in the conclusion, in our population it was skin type up to 3, about 80%, so Caucasian mainly. So this is actually a limitation, and I really am excited to continue doing this work with other colleagues in also different countries, because this is really required to get a global view on this problem. So this is indeed a good issue, and we should tackle this in the future. Yes.
Thank you, Nanya. Nice listening from you. And